the lipid profile or lipids what we have in our body, and how they affect us in a good way or a bad way. What are the reasons that they increase, and then what harm do they cause? What are the kind of medication, the lifestyle modification that we can do to control this? And if they are high, what do they suggest, and what are the diseases that it can cause? So, lipids are actually in layman term, it is a fat molecule. It is present in our body. See, we require fat in our body. It is not that we do not require it, we require it in certain amount, because they are the ones who are responsible for production of cartilaginous tissue, and certain hormones, which, and they are very, very important for our body. So not that we do not require these lipids, we do require, but when they get in excess, they start to cause harm to us. And harm that they cause is, it is a fat molecule, so it gets deposited in our body. So where do they get deposited? They get deposited in our adipose tissue. Adipose tissue, that means it is in our in our subcutaneous tissue, in our organs, and organs involving organs like liver, around the kidney, around the heart, in the abdomen, and the subcutaneous fat, which is like we see the abdominal obesity, the obesity on the thighs, on the buttocks, in the arms. So these are the sites where they start getting deposited. And when they start getting deposited at certain places, they cause obesity, one. And obesity is of two types: one which is obvious that we see, and another is visceral obesity. That means there is fat deposited in and around the organs, and which is more dangerous than the physical obesity. But it is rare to have a physical obesity without having a visceral obesity. These this fat cells also get deposited in the blood vessels, which is known as atherosclerosis. This disease, this narrows the narrows the lumen of the arteries which supplies the blood. And if the blood supply becomes less, then there can be a disease like heart attack, there can be stroke, there can be a peripheral arterial disease, wherein there can be reduced blood supply to the peripheral organs, like many other organs like kidney, liver, or in fact to your limbs. So they get if there is atherosclerosis, then the blood supply gets affected. Blood supply also is reduced with other risk factors like diabetes, smoking, and familial high cholesterol. So this is very important that our lifestyle should be such wherein we do not cause harm to our body, and we do not get excess fat in our body, so that there is no compromise in the blood supply, wherein you can get all these serious complications. So how do we, what investigations do we do to know the lipid profile, and what are the components of the lipid profile? Now, lipid profile, normal lipid profile that we see usually in the labs, actually the labs are mushrooming all over, and there are 5 basic things that we see there. They are serum cholesterol, serum triglyceride, HDL, which is high density lipoprotein, then LDL, which is low density lipoprotein, and VLDL, which is very low density lipoprotein. These are the important 5 factors that of lipid profile. But there is an extension to it also, and there are other components to the lipid profile which is very, very important, like ApoB, apolipoprotein A, apolipoprotein B, and apolipoprotein little a. These are also the kind of lipid, and they have been found associated with the risk factors for the heart disease, stroke, etc. So it is important that we also check the levels of these lipoproteins. Then other important thing is homocysteine and HSCRP. This is an inflammatory markers. We should always have them checked as well because they are also responsible for the atherosclerotic diseases. Now, there is a ratio of this which is also important. Like there is a ratio of triglyceride to HDL and ratio of LDL to HDL. This ratio is very, very important because if even if individually the LDL level or say HDL level is normal, but the ratio is high, which signifies a risk factor. So when a doctor looks at a lipid profile report, they think of many things, just not the figures, which is more than the normal ranges it is given. We have often seen in our OPDs and in our practice, in so many years of experience, that patients tend to see only the normal levels. And if it is lower than that, and they are very happy seeing the report that I am fine, I do not have any problem. Also, when you have certain comorbidities like diabetes, if there is a heart disease, if there is a kidney disease, so the target levels that we require to achieve of these lipids are much lower than the normal ranges it is when it is given. So whenever there is a lipid profile conducted, it is necessary that you go and meet doctor. It needs to have a review with your doctor rather than having an interpretation yourself. So please, it is an advice that whenever you have the blood test, have it reviewed by a doctor. Do not just sit over it that it is going to be, it is normal, I don't need to do anything. Why I say comorbidities are important is that, say, diabetes itself is a comorbidity which is so rampant all over the world, and India being the capital of diabetes, it is so important that we consider this diabetes itself is a risk factor for a heart disease. Smoking adds to it, obesity adds further to it, hypertension adds further to it. So all these comorbidities are very, very important. And when we do the lipid profile, it should be looked in by the, all the comorbidities. And there are various scores available medically in our field wherein we calculate the risk and then we decide what is the target level of lipids that we want to achieve. Once we have achieved this target level, then we do not escalate the medicine, but we keep on escalating the medicine or medicine dosages, or keep on adding other medication to have that level, that comfortable level of lipids, so that the atherosclerotic process doesn't continue further. It actually slows down. Because if the atherosclerosis is a continuous process, it needs to be continuously monitored, it needs to be continuously treated. If we achieve a target level of lipids, then we have to continue with the medication. We do not have to stop it. The minute you stop it, the levels will go high and the risk will increase. Now, what increases your lipid levels? One, there is a familial hyperlipidemia. That means the lipids go high because the familial tendency is there to have the high lipids. This is in the genes, and we cannot change our genes. So we have to accept that, yes, these are there and we need to address them. Many people must have seen in and around their family that thinnest of the people get, say, heart attack or say get stroke. How do they get this? And they have been found to have high lipids. How do they get it and why does it happen? The answer is that this is genetic, this is familial, and that is why they have the high lipids, and they are getting these complications because of the atherosclerotic disease. Then second is the reason what you eat. As they say, what you are, what you eat. It is partially true, and here it is true because the lipids increase because of the high density fat intake in our diet. We have so many restaurants and the fast foods available, and it is now with the help of, say, Zepto or Zomato. It is available to us so easily that we don't want. The people have started cooking less at home. People tend to eat outside, order outside, but we don't know what quality of food we are getting, what kind of oil they are using, what kind of creams, butters, all those things which are being used, how much sugar does it have, what calories do they contain. And when all these foods, when they are ordered out, or if you tend to eat out frequently, then you will have high cholesterols. Triglycerides, when I talk about the triglycerides are the end product because of the carbohydrate metabolism. So if you have high amount of beer, if you have high amount of alcohol, if you have high sweets, a lot of sweets, then you will tend to have high triglycerides level. More than cholesterol, what is important is a LDL level or low density lipoprotein level. They have been directly seen to be associated with the atherosclerotic heart disease or a heart attack. Here, these are because of your fat intake. So reduce your carbohydrate and fat intake. It is very, very important that you keep your diet under control so that you do not have high levels of lipids. Now, then VLDL is actually, it should be individually calculated. Usually in the labs, peripheral labs that we see, that it is a calculation which is done. However, the calculation should not be done. It should be individually calculated. So when we see that what is the level, it is a good level of all these cholesterols. So if we see triglyceride should be less than 130. It is in many labs, it is 150 and above. 200 is a normal level, but all of us should have less than 130 triglyceride. LDL should be also less than 130 if you do not have any comorbidity or obesity or any kind of a disease which is going on, including obesity. If it is HDL for men, it should be above 50, and for women, it should be above 60. LDL is a good cholesterol, and we do not have any medication for increasing the HDL level. It is only it is only by exercises it increases. So for men and women, the level is different, and you should always try to keep a high HDL level. They are protective to your heart. Now, there are many kinds of medications which are available. In fact, in India, unfortunately, they are also available over the counter. So most common medications that are available are statins. Now, there are various kind of statins, and your doctor will help you which kind of statin to be used, in what dose to be used, for how long to be used in that particular dose. So you must not try to self-medicate with the statin, and you should always try and visit your doctor and then start with any kind of a medication. There are many other medications also which are available to reduce cholesterol. The ones which can be used is omega-3. There is something known as niacin, which can be used. There are PCSK7 inhibitors. There are statins. There are fibrates, which are available, which decrease the cholesterol levels. There are various indications available for use of all these drugs, and they should be used in appropriate dosages. And so you should always go to a doctor for the start of the medication. What uh, what are the risk factors? What if we do not take, or we now do not maintain our lipids, what can be the risk factors? Now, risk factors, what are the additional risk factors besides having high lipids for the cardiovascular disease? What are the additional risk factors, like, advancing age, if there is associated diabetes, blood pressure, if there is a kidney disease, smoking, if there is a heart disease, obesity, especially the abdominal obesity, if there is a family history of high lipids, and if there is increased level of lipoprotein, then they are actually the high risk for the cardiovascular disease. And that is why it is important that we control our lipids when you have high lipids. Uh, treatment treatment goal is always a triglyceride of, as I said, triglyceride of less than 150, LDL of less than 130. If there is a moderate risk, then less than 100. If it is a high risk, then less than 100. Then it is a very high risk, then it is less than 70. And extremely high risk, then it is less than 55. So we even target a less than 55 level of LDL. So please do not self-medicate on this. If there is a apolipoprotein, then we would want to keep it less than 90 ideally. But if it is associated with a risk, then less than 80 and even up to less than 70 is what we want to keep. So this is very important that we maintain treatment along with the exercise. Exercise is very, very important. Exercise helps reducing these lipid levels. And nutritional therapy is very important. Cessation of smoking. Then there are certain bile acid sequestration drugs. There are certain cholesterol absorption drugs which are used, and there are combination therapies which are used. Which we use to reduce the lipid levels. And there are various kind of statins which have different role. That means, for example, if I have to prescribe, say, lovastatin, and if I have to prescribe you say rosuvastatin or pitavastatin, the dosages are different. They cannot be compared. Their maximum dosages are different. So, and their dosages during a acute event like acute stroke or acute heart attack, it is different. So please, again, as I said, do not self-medicate. Please go to the doctor for the treatment of your high lipids. There are many kinds of drugs which control triglyceride also. These are fenofibrate, gemfibrinogen. Again, they have different dosages, and they have again, but their targets are different. There are other newer medications also now which are available for the treatment. They are in the injectable form. They are PCSK9 inhibitors. They are elorocumab and evolocumab. They are given weekly. In fact, they are given every 2 weeks, and they can be administered subcutaneously. They are costly injections. They are available in India. So people who do not tolerate statins, whereas Indian people actually usually very easily tolerate statin. The statin has a side effect like muscle pain or increased level of CPK, and there is lethargy. So and there can be a increase in liver enzymes also. There can be a liver toxicity also. So when you start, again, you start with the advice of a doctor, and when you start it, the doctors usually tell you to do certain tests. They tell you if you have any such symptoms, report back to us. So when these medications are intolerable, then there are other medications which are available, is what I told you, like PCSK9 inhibitors, which are available in an injectable form. And when you give them twice weekly, and it is given in a subcutaneous form. There are certain MTP inhibitors also, which is available, lamivudine. It is given in 5 milligram starting dose, and it is gradually increased up to the 60 milligram. And these are given, but again, they have a liver toxicity. And so they also needs to be monitor how the person is tolerating it. For certain fatty liver and all, also there are certain drugs which are given, like saroglitazole, which also tend to reduce the lipids, but they are not approved for lipid lowering drug. But however, they are being used in practice as a off-label use in patients. When you have dyslipidemia or increased lipids and you have comorbidities, as I said, then the target of each lipid that we want to achieve is different. And so when you have comorbidity, please visit your doctor, or anytime for that matter, you should visit your doctor, not to self-treat it. And take advice and follow that and have a regular checkup. Now, how often should you do your lipid profile? It should be repeated every 3 months if you have a comorbidity or if you are on a drug. Minimum 3 months, you should repeat your lipid profile. Lipid profile should be done absolutely in a fasting state. 14 hours of fasting state is recommended for before getting a test done. So you should not have a high fat meal at least 24 hours prior to getting a test done. And it should be absolutely fasting. You can only have water, avoid that as well. And there should be 14 hours of fasting before taking a test. If you have had anything in the morning, please do not, because the interpretation changes and you will have falsely high levels of lipids that will be seen. Dyslipidemia or high lipids in certain infectious disease is also, the recommendation is different. In say for example, people with HIV will have a different recommendation of a lipid. And in women, they have different levels that we want to achieve. In elderly, we want to not give you a very strong medication. We want to give you a low medication. At the same time, maintain the low level of lipids. Post-heart transplant, post-liver transplant, post-kidney transplant, also you have to be careful while prescribing the drug, and always monitor the liver functions and the CPK levels once you start them on the statin. So I think that's all I want to speak about the lipids, and I'll be happy to answer if there are any questions. So I can see a question in a chat box which is from Sonraj, and who says that how does the cholesterol affect the heart pumping, and what role does it play if there is a hole in a heart? Now, I would like to just explain this a little bit more, that how does heart function? So heart has 4 chambers. And if there is a hole in a heart, it is in between the 2 chambers. So if there are 2 atrium, if there are 2 ventricle, so between 2 atrium, there is a hole, and a 2 ventricle, if at all there is a hole. And this is usually present, it is present since the childhood. Cholesterol has nothing to do with a hole in a heart. As far as pumping is concerned, so cholesterol directly doesn't, but indirectly affects the pumping. Now, heart muscles also require blood supply. So heart muscles are supplied by the arteries known as coronary arteries. When there is high cholesterol or there is a fat in the blood vessel or coronary artery, it gets blocked. So it doesn't supply the blood through the heart muscle, and that is when you get a heart attack. So it is an indirect, when there is a heart attack, that means the blood supply is not going to the heart muscle, and heart muscle will then not be able to pump the blood out. So that is how it is an indirect effect on heart pumping. The heart will not get the blood supply, that will cause heart attack. Heart attack will reduce the heart pumping. So the cholesterol definitely has a role there, that if it is a high cholesterol, you should try and reduce it by the drugs. Now, the next question is, what are the target limits of lipid for the diabetic person? So the diabetic person, so if it is only diabetes, no high blood pressure, no heart disease, no kidney disease, then the targets are different. If there are risk factors, the risk goes on increasing, and risk is like mild, moderate, severe, mild, moderate, high, and then very high risk. So if you have only one risk factor, then the target level of LDL is less than 100, and if your triglyceride is again less than 130. But if there are multiple risk factors, then LDL level goes less than 70 and less than 55, and triglycerides level goes less than 100 and less than 70. How to manage the cholesterol without medication? So, if there is a familial hyperlipidemia or there is familial high lipids, you cannot change it. This is in your genes. You cannot change it. Even the youngest of the people we see high lipids, it cannot be changed. No lifestyle modification will change it. But what you can do is exercise. Exercise is very, very important part. And two, you should eat healthy. Eat healthy meaning you should not have excessive fat, you should not have excessive carbohydrate. 50% of your diet should have a raw food. You should have a lot of fruits and vegetables, and you should not be, you should avoid having anything which is fried. You can have dry roasted things, you can have roasted things, but you should avoid, and unless you avoid all these things, your cholesterols are not going to go lower down on its own. So the lifestyle modification has to be really severe and continuous, very important. So when people see their reports, they get alarmed and they go on a very strict diet or a strict regime and a lifestyle modification. And what happens? They get tired of it, and within a month, they actually go back to their old lifestyle. It doesn't last. So try everything in moderation and stick to it. That's the key to have a lifestyle modification. There is a question from Kamlesh Maurya who says, few months ago, I was tested with high triglycerides, which were around 366, and now they have come down to 78 by increasing physical exercise. I also reduced 20 kg. What should be your suggestion? So this is very good example of uh, uh, of actually, attempt to lose weight and maintain it. So this level is an ideal level and it is very good. Please continue with your exercises. Put your and if you do not, if you stop your exercises and do not uh, take care of your diet, then let me warn you that it may go high again. And you please maintain your present weight, and it will. This is a very good attempt to reduce it without a medication. I hope you are not taking any medication. Sakshi, what is the normal ratio of LDL and HDL? Actually, it depends on the way it is measured, the units in which it is measured. So it varies from lab to lab. Here, I don't want to give you any figure as such. Want to understand how to improve good cholesterol? What is the recommended oil that can be used to cook food? So good cholesterol, which is HDL, high density lipoprotein, it doesn't have, we do not have any medicine. The medicines which are available have, minuscule effect on the raising the HDL. It is only by the exercise that you increase high HDL. And there are certain genetic factors also. So some people are born with very good protective high density lipoprotein. In those cases, it is different. But the exercise is the only way wherein we can increase the high density lipoproteins. The oil. So in oil, what we have a monosaturated the MUFA and a PUFA, fatty acid monosaturated and a polysaturated fatty acid. The ideal is to use a combination of two. So when you have a combination two, what are the good oils which are recommended are the best oil which is said to be is a coconut oil. So, a coconut oil, groundnut oil, till oil, all these are considered to be very good. Even the sarson oil is considered to be very good. So, it is recommended that you should either change your oils or you should use a combination of the two oils so that you have a balance of a MUFA and a PUFA. Can triglyceride cause high cholesterol? So, see, it is not one lipid causing other lipid to increase. No, it is not the same. They have independent mechanism, but it is usually seen that you have a high cholesterol, the triglycerides are also high. We do see patients where the cholesterol, say LDL, is high, but the triglycerides are normal. But all these are then the genetic factors which are responsible for this. There is another question. My cholesterol and triglyceride level are normal, but xanthelasma is still there on my eyelid. What can do to remove it? So there are certain chemical available to remove it, and there are certain machines which are available to remove it. You must visit a dermatologist for the help. Which is the best edible oil for the heart patient to enjoy tasty fried foods without affecting cholesterol levels? So no oil in this world which can not increase your cholesterol. The fried food is absolute no for the heart patient. In fact, for anyone for that matter, if you want to use it for a change. Routinely, one should not eat fried food. No oil is good. And if you have a family history of sudden cardiac death, of high cholesterol, then you are carrying those genes. So remember, you have a high risk of getting it. So please be careful. Control your taste buds. Lead a healthy life. Exercise regularly and eat healthy. Cholesterol serum is 260. Is this high? If yes, how to control this? As I told you, only one report doesn't help me advising anything here. So I should have a full report and a history. Then I can advise you what is the right way and what should be the ways to control. But yes, as I told you, eat healthy, not to have any fried food, a daily exercise. This will definitely help you get down your cholesterol. How to maintain healthy level of cholesterol in a body given that the routine nowadays is so hectic? Yes. First of all, let's understand our primary responsibility is towards ourselves. If we are not able to give 1 hour in 24 hours to ourselves, that means we are doing something wrong somewhere. We are becoming over ambitious and we are ignoring our health. We are we are in a rat race to achieve high, but at the cost of our health. We are not able to eat healthy, exercise, that means we are not doing justice to ourselves. So there is something somewhere grossly wrong. Either you are, if you are spending a lot of time in traveling, please find a place near your workplace, or find a work near your residence. If you're not, your work hours are long, then even if you get little less money, I would say please change your job. This is why I'm saying, is because otherwise you will spend money on your, on a doctor's fee and on the medication. So you have to choose where to spend money and what should be kept at stake, your health or the money that you earn. So it is very important to take a holistic view towards your life, towards your job, and towards the time that you are giving to your job, including your travel time, especially in metro. Is there a risk of plaque buildup in a long run if LPA is 70, LDL is maintained below 50, and arterial inflammation under control? This is a very good level. In that case, you have to maintain this if with the medication or and with the exercise and a diet, then the risk becomes much less, much less as compared to otherwise. What are the precautions which we need to take to avoid cholesterol? So precaution is, as I told you, do not eat healthy, do not eat unhealthy food, do not walk or say exercise, do not eat fried food, do not eat do not eat red meat. All these things, they increase the cholesterol. So when you control your eating, eat wisely, exercise wisely, then you will have all these things under control. How to avoid cholesterol? And nowadays I have to check the cholesterol level after previous check. So it is recommended that one should check your levels of cholesterol, or say you should have a blood check at the age of 40 and above if you do not have any symptoms. If there is any history of family history of diabetes, blood pressure, heart disease, kidney disease, then you should check it at least once a year, because these all are genetic factors and they you may get it. At the same time, of course, you have to maintain your weight. If you're obese, if then you should check it often and try and keep your weight under check. Another question is how to prevent pain in the heart. I need to understand this little better. It is better to visit your doctor. And cholesterols, or and if your cholesterol levels are normal, then you check it after 40 every 2 years. If they are abnormal and you are following up with the medication, then you must check it every 3 months. Okay. I see that there are no more queries. So thank you very much.